Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know we don't have any absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office today with complaints of his legs and feet feeling cold and sometimes achy. Sorry, let me start over. A patient presents to the office today with complaints that his legs and feet are feeling cold and sometimes achy. Upon examination, the nurse practitioner notes that the patient's legs are cool to touch and shiny and pale in appearance. Based on this presentation, what is the most likely diagnosis? Is it A, PAD, B, CBI, C, DVT, or D, varicose veins? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, so it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, based on this presentation, what is the most likely diagnosis, right? So let's figure out what is the presentation, right? Anyway, I tell you, if they're asking for a diagnosis, you want to run it back and look at those assessment findings, right? So this patient came in, they're complaining that their legs and feet are cold to touch, they're sometimes achy, and the nurse practitioner notes that the patient's legs are shiny and pale, and they are cool to touch, right? So when you're thinking of those presentations, that's one of those scenarios when, Brittany's brilliance, I say, when I say this, you say that. When I say shiny, pale, cool to touch regarding lower extremities, you need to think PAD. PAD being peripheral artery disease, right? And if you struggle with PAD and CBI, go look at my video. I have my Brittany's Brilliance for that. That a lot of my reviewers find helpful for it. But remembering that I say peace up, A town down. You know how the song goes with that. And so peace up, meaning like if you make the peace sign with your fingers, it looks like a V shape, right? And it's pointing up, right? Peace up. So the V and CBI, chronic venous insufficiency, veins bring blood back up to the heart, right? Whereas A town down, A being pointed down, A for arteries for peripheral artery disease, our arteries bring blood from the heart down to our lower extremities. So when you have peripheral artery disease, there is a deficiency. There's something causing the arterial system to not function effectively, right? So the blood flow is not adequately being pulled from the heart down to the lower extremities. That's why your extremities may be cool to touch, they may be pale in color, there may be lack of hair growth on the extremities, it may be really shiny in appearance, okay? So here the best answer is A, PAD. Question number two. A patient presents to the office today with complaints of a reddish area to the lower portion of his legs. Upon examination, the nurse practitioner notes mild redness to the left lower extremity and ulceration to the right lower extremity. Based on this presentation, what is the most likely diagnosis? Is it A, PAD, B, CBI, C, DVT, or D, varicose veins? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, based on this presentation, what is the most likely diagnosis? So again, we're going to look at those assessment findings, right? So this patient came in complaining of a reddish area to his lower extremities. The nurse practitioner notes that on the left lower extremity, there is some mild redness, whereas on the right lower extremity, there is some noted ulceration. So again, thinking about what I just explained on my Brittany's Brilliance on arterial versus venous blood flow, right? Veins pull blood back up to the heart. Artery brings it down from the heart to the lower extremities. So here, This patient is having ulceration because that blood flow is pulled for whatever reason due to there being an insufficiency in the venous system. So they are having ulceration. That blood flow is not being circulated back up to the heart. So the best answer here is B, CVI, chronic venous insufficiency. And then lastly, question number 3. A patient presents to the office with complaints of pain to his left calf. Upon examination, the nurse practitioner notes warmth to touch and a positive Homan sign. What is the best diagnosis? Is it A, PAD? Is it B, CVI? Is it C, DVT? Or D, varicose veins? Take a moment and tell me what you got. All right, so stem of the question here is what is the best diagnosis? So again, we're going to take it back and see what those assessment findings are. So a patient presents to the office, they're complaining of pain to the left calf. The nurse practitioner notes it is warm to touch, and there is a positive Homan sign. Y'all, this is classic presentation for a blood clot, DVTs, right? So the best answer here is C, DVT. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. Also, I will add the PAD and CBI video in the description in case that's something that you struggle with. So you'll see me discuss it and walk through it a little bit slower so that you're able to retain that, okay? But if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in the ebook or paperback option. They're both linked in the bio of this channel. If you prefer to do a review independently, I have a self-paced review for family and adult Gero that is also linked in the bio of this channel. If you prefer to be in a group review, the upcoming 5-week group intensive for family and adult Gero starts September the 9th. I have 2 more spaces available. If you're looking to join, the link is in the description to join us. This is the last one for the year. Any of the Q banks, if you just want to practice and test your knowledge, all of my Q bank options are available in the bio as well. If you have specific questions, my website is linked in the bio. You can shoot me any inquiries or just reach out via phone or email. And then lastly, I don't know if you've seen the post, but I have relaunched my membership program, but this is more specifically to my new nurse practitioners. I have heard your request. I know I've been working with you guys, but once you pass boards, you're finding yourself saying what to do next, struggling with credentialing steps, interview tips, looking to see if offer letters are acceptable and how to negotiate, writing SOAP notes, and just knowing those things to do and having a mentor to bounce questions off of that you may feel like are too easy or you don't have access to ask someone on the job. Well, I have opened this up. We'll be starting this September the 9th. The enrollment is open now so that you can join and have the access and tools and material and resources to help you navigate as a new MP. So you can go out here and shine your light confidently. So if you're looking to do that, look at the link. I'll also add it in the description, but to enroll, there's a post on it as well. But as always, you guys, if you need any of the resources, feel free to reach out to the nursing studio. But y'all make sure y'all meet me back here. Happy studying. Bye, y'all.